Welcome to the team technical presentation for the remote capture of standardized dermatology outcomes measures in clinical practice project, sponsored by Dr. Robert Swerlick. This presentation was prepared by the Eastern FHIR coders for the Health Informatics course at Georgia Tech. To collect patient responses, a responsive web page will be used. The responsive web page allows the patient to use a mobile device or standard computer browser to answer the SDOM questionnaire. The patient scrolls down the web page when completing the questionnaire. The mock-ups show the layout of the questions on the SDOM questionnaire. The clinician has two options for viewing the patient's responses. With the first option, the clinician can zoom in on the patient's responses for the current office visit. All of the patient's responses for the current office visit are displayed on one web page for a quick assessment. With the second option, the clinician can view and compare patient responses for previous office visits. There are several line graphs presenting data on this page. The Skindex is presented in the first line graph. Patient responses for the questions related to the skin condition are in the second line graph, while the current skin problem rating and how your skin felt responses are displayed in the third line graph. The response to treatment and side effect responses are displayed in a table for side-by-side comparison over time.
Hi, let's take a look at the high-level architecture of our application. The application aims to better facilitate standard dermatology outcome measures by collecting patient data in advance. This is done by using a form on a phone, a tablet, or a PC instead of a paper form. The application consists of a customer or patient-facing page, a processor to convert the data into a FHIR-compatible format, and a data access layer which would write this patient data to the underlying database. The patient accesses the intake form using an email link or by directly going to the site. When the patient tries to access the application, he or she would have to authenticate using OAuth 2 to the Emory Healthcare system. OAuth 2 is a token-based mechanism used for authenticating access to third-party applications and single sign-ons. The patient will then be prompted by the service to authorize or deny access to the application. Once the patient grants access, he or she will be directed to an intake form and fills the relevant data. This data is collected and is converted to a JSON file that is FHIR compatible. This is done by processing module within the application. This information is then stored in the Cerner Millennium database or to a PostgreSQL database. The data stored in the database can be viewed by a clinician through the Cerner Millennium Clinician Dashboard. The dashboard would provide various statistics based on the data. Note that from a patient's perspective, the data is only written to the database. That is, the patient would not be able to view any of the historical data. Now we'll take a look into the tools and languages used in our application. We have chosen Python as a programming language for our application. We will be using the Django framework to build the application. We will also be using FHIR Client, a flexible Python client for FHIR servers supporting the Smart on FHIR protocol. The data will be written to a PostgreSQL database, and the whole application will run in a Docker container.
The project timeline is shown on this slide. The project leader updated the timeline with subtasks to assign responsibilities to team members.
These are some of the concerns that we currently have with our application. FHIR supports questionnaire and questionnaire response records, but Cerner does not currently support them. Cerner FHIR does not support patient rights for most resources, so we will have to store form data in a separate database. As per Elizabeth Sprouse, Emory's patient-side FHIR will not go live until February of 2019, and so we will have to test against their vendors' provided sandbox, which is code.cerner.com.
Thank you for watching this presentation.